Hi, welcome back to Focal Point AFR Talk. Brian Fisher is my name. Great to have you in the conversation. 888-589-8840 is the number to call. We're 2 days into Obamacare now. It officially went into effect yesterday. Already we're starting to have huge problems with Obamacare, with the rollout. I got to find this story down here in the stack somewhere. I got to get to it. So give me just a second to find it, because it had to do with a woman going in to get a prescription fulfilled on New Year's Day. In other words, the first day that the wonders of Obamacare were rolling out. And even according to the White House's own numbers, way more people have lost insurance than have gotten insurance under Obamacare. 6.1 million, this is according to numbers provided by Daniel Mitchell, just accumulating all of the government numbers that are out there. Over 6.1 million people have lost insurance. They've had insurance canceled by Barack Obama. They don't have insurance on January 1. Today, they don't have insurance because of Barack Obama, 6.1 million. And according to the White House's own numbers, only maybe 1.1 million have actually enrolled in a health insurance plan. And that does not mean they've actually purchased insurance. Enrolled, all that means is they picked a plan. The government has absolutely no idea how many people have actually paid for the plans that they have selected. You know, I bought some stuff online over Christmas just like you probably did. I mean, it doesn't count as a sale just because you've got it in your cart and you're in the checkout lane. You got to pay for it. You got to give the man your credit card number and all that stuff and your security number on the back of the cart before that sale is complete. If you don't pay for it, it's no sale. Just because it's in your cart doesn't mean anything. So these are people that have a plan in their cart. There's no evidence that these people have paid for it. So even in the best numbers, even if 1.1 million people are not only enrolled but have actually paid for insurance, that means six times as many people have lost insurance as have gained insurance under Barack Obama. Now I got to find that story because it's just illustrative of the problems that we are running into here. And obviously I am killing time on the radio, which we're not supposed to do, to try to get to this story. Here he goes, at the bottom of the stack naturally. This is a report from Indianapolis. This is from the trenches of Obamacare. First-hand account. My wife just returned from Kroger, and she had a freaky tale to tell. She attempted to have a prescription filled at the Kroger pharmacy, but our Medco rejected payment. They were informed that Kroger was no longer a provider. All of the pharmacy employees looked spooked out of their wits. In other words, they don't sell prescriptions. They go out of business. They don't have jobs. The head pharmacist was trembling. It has been going on like this all day. They admitted that Medicare was doing the same thing, so Medicare wasn't allowing people to fill prescriptions there, and for odd reasons such as the absence or presence of middle initials or LN versus Lane in the address. Other insurers reported systems down and network problems. My wife asked one of the pharmacists there, if any prescription refills had been approved. The woman refused to answer. So if the media does its job here, you're going to see one story after another just like this of the catastrophic failure of Obamacare. This is Chernobyl care. It's the Hindenburg. It's a flaming train wreck. You cannot come up with an analogy that's strong enough to describe the catastrophe this is going to be. And see, the reason I'm exercised about this is not just a political failure. This is not just a public policy failure. This is a failure that is hurting people. It's hammering people. You know, it's going to be interesting to me to see how many people go into Walmart. I'd hate to be a Walmart pharmacist this month because I think they're going to be hit with people who are going to come in who believe that Obama has already paid for everything, that everything is free. All they've got to do is just show up and they can get their prescription and Uncle Obama has already paid for it. Or they can go to the doctor and all they've got to do is just show up because Uncle Obama, Barack the Benevolent, has paid for everything. Now, if the media does its job, those are the kind of stories that we are going to hear. Now, if they continue to be in the tank, as I expect they will be, then maybe we won't be. Now, I want to get to a couple of more sound bites, 888-589-8840, but I got another winnable war moment for you, and this is from the litigation front on sanctity of life. Remember, Obamacare mandates that every employer's got to pay for abortion-causing pills for their employees. They have to provide a plan that provides for abortion-causing pills, abortion-inducing pills, abortifacients for their employees. Now, there's and so these cases have been litigated because these companies are simply not going to do it. These nonprofits, these for-profits, they're not going to do it because it violates their conscience, their most deeply held conviction about the sanctity of human life. Now, here's the good news that a lot of people don't know. ADF, Alliance Defending Freedom, released this today. 88% of court decisions in 2013, 88% of court decisions in 2013 went against this Obama abortifacient mandate, 88%. In other words, in court, the sanctity of life has won 53 times. Abortion has won 7 times, 53 and 7. You produce a coaching record like that, you're on your way to the Hall of Fame. Let's see if I got some specifics here. The score in favor of nonprofit religious entities, the latest one was the Little Sisters of the Poor. Sonia Sotomayor was the one that refused to let the mandate go into effect for them. They were going to face a fine of $1 million a day starting yesterday if Sonia Sotomayor did not issue this injunction, because there's no way the Little Sisters of the Poor are going to provide abortifacients. I mean, these are nuns. Probably a lot of them are past childbearing age anyway, and they're caring for the elderly. I mean, these are people that would have no use for abortifacients anyway. And besides which, even if they could, they're not going to pay for it. They're not going to provide it to their employees. They're nuns, criminally. I mean, if anybody, and so they weren't allowed by some lower court judge, they weren't allowed to be exempt from this requirement. Sonia Sotomayor said, no, you're exempt until I hear more on Friday. But the score in favor of nonprofit religious entities like American Family Association is 18-1. The score in favor of families doing business, 35-6. So that's private for-profit entities that are run by Christians who have these deeply held religious views. Well, let's grab a couple of sound bites, 888-589-8840. Here's Howard Dean. Howard Dean's a medical doctor, former governor of Vermont. And Howard Dean's been one of those guys that's been kind of willing to tell the truth about Obamacare. Here he is with Joe Kernan. Let's listen to clip 1.
Howard, you're also expressed some concern about, I guess we know that young people, young healthy people, you're probably not getting enough of them at this point, right?
It doesn't really matter that much. Honestly, the actuarial data, this is about the individual mandate. I happen to agree with Joe. The individual mandate was not necessary, and it's probably a big political thing, and that is going to hurt the Democrats because people don't like to be told what to do by the government, no matter what party they're in.
That's kind of an astonishing admission. Did you get what Howard Dean? I mean, this guy is speaking like a conservative. I mean, our whole first hour was kind of built on this, around this whole subject of the American people just do not want to be told what to do by their government. We want the government out of our business, out of our diets, out of our thermostats, out of our cars, out of our workplaces, out of our menus. We want the government out. And here's Howard Dean, card-carrying member of the Democratic Party. This Obamacare, this individual mandate, is going to hurt the Democrats because people don't like to be told what to do by the government, no matter what party they're in. Here's Howard Dean, clip number 2, admitting we're just starting to see the beginning of problems, talking to Chris Wallace, Fox News.
Governor Dean, how much confusion on January 1 when people who think they've signed up under the new system go to see a doctor?
Well, probably less than we think. Look, this system is based on what Mitt Romney did in Massachusetts. It's a private sector plan. It actually was designed by people at the Heritage Institute, and I think it will work. It wasn't my favorite plan, but I think it will work. But there are going to be dislocations. I think the reason there are not going to be as many as most people think is because most of the people who are getting signed up are healthy. And so there is not going to be a huge rush to the doctor on January 1st. But there are going to be problems. There's not any question about it. And I think we'll work through them. And I think by March, this whole thing will be running a lot more smoothly.
You were shaking your head, Doctor.
Yeah, I mean, if you look at the demographic data, the underlying trends and who's enrolling, there's evidence that's less healthy. It's a less healthy population than what the plans certainly hope for, and probably older. You have to look at the state-level data because they're not putting out national data from healthcare.gov. So when you look at the state-level data, what you see is a lot of people are signing up for more expensive plans. They're buying the gold and platinum plans, or they're buying the silver plans, when everyone thought they'd be buying the cheaper bronze plans. Now, the only reason you'd buy a more expensive plan is if you think you're going to tap the healthcare services, because effectively what you're doing is you're paying higher premiums to pay down your deductible and copays. And you only do that if you think you're going to use the healthcare. That's an indication that this is a less healthy population.
I want to get to some of the
No, I think that's true. But even, go ahead. I just say I think that's true. I think that but in general, that most people don't go to the doctor every single month. You have to be fairly unhealthy to have to do that. And so I do, Scott's not wrong about that, though. I think he's right that what he just said, that the data does show that less healthy people are signing up. Younger people are signing up less frequently than hoped.
Oh, Howard Dean contradicted himself from the first part of the soundbite to the second. He said the first part of the soundbite, most of the people signed up are healthy. Then he's confronted with the facts and with the truth that these people are buying more expensive plans, which means they're sicker and less healthier. They know they're going to need health care services, so they're trying to cover themselves. So he changes his mind and says, yeah, I think he's right. The data does show that less healthy people are signing up. Younger people are signing up less frequently than hoped. And this whole thing is predicated on young, healthy people signing up who are going to pay for services they don't need. This cannot work unless 40% of the people that sign up for this thing are between 18 and 34 and aren't going to need insurance coverage. It's massive redistribution of wealth from the young, hardworking millennials to older senior citizens who maybe even retired. It's all shifted their direction in order for them to get health care. Massive redistribution of wealth from the young and poor to the old and the affluent. And you notice Howard Dean trying to blame this on the Republicans, blame it on Mitt Romney. Well, Massachusetts, by the way, has got the highest health care costs in the country thanks to Mitt Romney and Romney Care. So maybe there's some truth to that. Back in 2.